Hello, my name is Dominique Brooks, and these are my colleagues Amy Haas, Olivia Hertzler, and Aaron Carney. And today we will be representing our group's organization, Recess, which stands for Recreation and Eating Clean Helps End Slow Starts. Our mission is to reach out to children struggling with obesity through recreational activities and nutrition. The causes of obesity can range from genetics to just simply not meeting the daily requirements for physical activity. So today we will be taking an in-depth look at the different areas important to know to keep from becoming obese. These categories include risk factors of becoming obese, diseases associated with obesity, nutrition, and physical activity. I would like to begin by defining childhood obesity. Childhood obesity is defined as a condition in which excess body fat negatively affects the child's health and or well-being. Obesity, in addition to overweight, is the sixth major cause of disease risk worldwide. It has been estimated that 1 billion adults are currently overweight, and an additional 475 million adults are considered obese. It has also been estimated that 200 million school-aged children are overweight worldwide, and that 40 to 50 million of these children are classified as obese. Healthy People 2020's objective in regards to weight management in children is to reduce the proportion of children aged 6 to 11 years old who are considered to be obese. According to Healthy People 2020, 17.4% of children aged 6 to 11 years old were considered obese in the years between 2005 and 2008. Healthy People 2020 target is to reduce the amount of children aged 6 to 11 years old who are considered obese from 17.4% to 15.7%. Many individuals are unaware of the role of genetics when discussing obesity and the aspect of a parent's unhealthy eating habits and the harm that it may inflict on their children. Studies in twins, no twin siblings, and adoptees have shown that genetic components contribute from 40 to 70% to the inter-individual variation in common obesity. Research has also shown that the influence of having one obese parent throughout childhood and adolescence increases an individual's risk of adult obesity 2.2 to 3.2 times more compared with someone whose parents were not obese. To help lower the percentage of obese children in America, we must educate the general population on the health risks that coexist with eating and obesity, such as eating processed or fast food high in fat. A recent statistic indicates that children between the ages of 6 and 14 eat fast food 157 million times every month. Another risk is not eating fruit, vegetables, and unrefined carbohydrates, such as whole wheat bread and brown rice. Another risk is eating out excessively. Most individuals start off with an appetizer and end with a dessert when eating at a restaurant, not being aware that the actual food selection can be higher in fat and sugar than their dessert and appetizer, which puts them at a higher risk of overeating. And lastly, eating larger portions. Research shows that people unintentionally consume more calories when faced with larger portions. Now we'll look at physical activity and the different risks that the lack of physical activity causes in terms of obesity. Research indicates that the lack of physical activity found to be the most significant factor in contributing to childhood obesity. The lack of physical activity does not only affect children aged 6 to 11 years old, but studies have shown a lack of vigorous physical activity is the main contributor to obesity for adolescents between the ages of 11 to 15 years old. Risks such as insufficient physical activity and prolonged time spent on sedentary behaviors like computer games and watching TV may equal and even exceed diet quality as important contributors to being overweight in adolescents. When receiving an adequate amount of physical activity in childhood and adolescence, improves both strength and endurance, helps build healthy bones and muscles, helps control weight, reduces both anxiety and stress, increases self-esteem, and may improve blood pressure and cholesterol levels. Now I will transition over to my colleague Amy Haas as she puts a major emphasis on diseases associated with obesity.
It should come as no surprise that risky health behavior can lead to disease. According to the American Heart Association, there is no definition of obesity in children that relates body mass index to health outcomes. However, more than 20% of children aged 6 to 17 are more than 20% overweight at the 85th percentile of BMI, and 10% of children ages 6 to 17 are at the 95th percentile. It appears that 50% of children who are overweight will carry these habits into their adulthood and also be overweight. Over time, lack of good diet and exercise can lead to diseases such as diabetes, heart disease, high blood pressure, and atherosclerosis. Many studies, including the Bogalusa Heart Study, have convincingly shown that childhood obesity is correlated with risk factors for cardiovascular disease, adult metabolic syndrome, and early development of atherosclerosis. According to an article titled Cardiovascular Disease in Childhood, The Role of Obesity, risk factors remain steady in adolescence and lead into adulthood unless BMI improves. Data from 4 prospective cohort studies have shown that overweight or obese children who were obese as adults had increased risk of type 2 diabetes, hypertension, and other cardiovascular disease. Diabetes is the 7th leading cause of disease in the United States. In type 2 diabetes, the body does not produce enough insulin, or the cells ignore the insulin being produced. Type 2 diabetes is becoming more common, especially among children. According to an article titled Obesity Type 2, Diabetes Rapidly Growing Among Children, the rate of obesity and type 2 diabetes among children in the U.S. is rapidly rising. Many children with type 2 diabetes don't even know they have the disease. According to the Center for Disease Control, a change that has occurred in the past few decades is that if a child previously had diabetes, it was assumed that it was type 1. Rather, today, type 2 is being more increasingly being reported. Healthy People 2020 aims to reduce the annual number of new cases of diagnosed diabetes in a population. Currently, the baseline is 8 new cases of diabetes per 1,000 population aged 18 to 85. Healthy People 2020 would like that baseline to go down to 7.2 cases per 1,000 population age group. Though this baseline does not include children, it is still important to remember that bad health behavior created as a child can lead to increased risk of diabetes as an adult. Lifestyle changes have proven to be effective in preventing or delaying the onset of diabetes type 2. Interventions are being created to further help high-risk individuals. According to Healthy People 2020, effective therapy can prevent or delay diabetic complication. However, more than 25% of Americans' diabetes are undiagnosed, and another 57 million Americans have high blood sugar levels that are greatly increasing their risk of acquiring diabetes in the next several years. Few people receive effective preventive care, which makes diabetes an immense and complex health problem to address. An emerging issue regarding diabetes is introducing the use of HbA1c for diagnosis of diabetes. HbA1c is a lab test that shows the average level of blood sugar over the previous 3 months. It shows how well you're controlling your diabetes. Changes brought about by this will affect the individuals who have yet to be diagnosed and help with understanding the prevention for the public. Studies have been conducted that suggest that techniques used for identifying diabetes, such as foot exams, eye exams, and measurements for HbA1c, may not be sensitive enough to capture all aspects of quality of care needed to reduce morbidity. New techniques are in process of being created to discover whether appropriate time care is connected to reducing risk factors. Evidence that diabetes can be prevented or delayed has been discovered and prompted new research. New ways are also being discovered of identifying high-risk individuals and creating new prevention programs for them. Diabetes is a deadly disease that affects children, especially children that struggle with obesity. Diabetes and other cardiovascular disease can be a nasty consequence of not handling nutrition and weight status appropriately. As a way of prevention of diabetes and other deadly disease, nutrition and physical activity are important. And now my colleague Olivia Herzer will address nutrition.
There have been some major changes in the way nutrition is being taught to children today. An article in the New York Times goes over these changes. For instance, in the past, the food pyramid was emphasized, where grains were on the bottom, followed by fruits, vegetables, meat, dairy, and then fats, oils, and sweets on the top of the pyramid. In June 2011, the plate was developed by the Agricultural Department along with advice from Michelle Obama's obesity team. The plate was created with children in mind. Some say that the pyramid was too hard to understand, especially for children. The plate's simple layout provided children with an easy visual to associate food with. What are the specific areas of the new plate? Half of their plate should consist of fruits and vegetables. Consuming fruits may reduce the risk of heart disease, strokes, and certain types of cancer. Fruits also contain many essential nutrients such as vitamin C, potassium, and folate. Vegetables do not have any cholesterol. Vegetables also contain vitamin A, which protects against certain types of infections. Healthy People 2020 strives to increase the contribution of total vegetables to the diets of the population ages 2 years and older. Currently, the baseline for vegetable consumption is 0.8 cups of veggies per 1,000 calories, but Healthy People 2020 has a target of 1.1 cups of vegetables per 1,000 calories. Eating whole grains contributes to digestive health, as well as weight management. A child's plate should also contain grains, with at least half of these grains being whole grains. A child aged 5 to 13 should have about 5-ounce equivalents of grains. A 1-ounce equivalent of grain is equal to 1 slice of bread, 1 cup of cereal, or half a cup of cooked rice. Whole grains are much healthier to consume than refined grains because whole grains contribute to digestive health. Examples of whole grain foods are brown rice, oatmeal, and whole grain cereals. Refined grains are okay to consume but should be at the most half of the grains of a child's diet. Refined grains are white rice, white bread, and pasta. Unfortunately, the fiber is not added back to refined grains, making whole grains much more healthier for a child to consume. Healthy People 2020 aims to increase the contribution of whole grains to the diets of people ages 2 years and over. Currently, individuals are consuming 0.3 ounces per 1,000 calories, but Healthy People 2020 would like to see that baseline go up to about 6 ounces of whole grains per 1,000 calories. Protein is another important component of a healthy plate. Proteins are the building blocks for bones, muscles, skin, and blood. Saturated fats are usually found in protein in those meats that are not lean, which can raise the LDL or the bad cholesterol, thus increasing the risk for heart disease. Children need about 5-ounce equivalents of protein. A 1-ounce equivalent is equal to 1 ounce of meat, 1 egg, 1/4 cup of chicken, lean cuts of pork, ham, and beef. The protein group also contains nuts and seeds as well as fish. Children need to learn the basics of portion control, especially when it comes to nuts. Even though nuts do contain a lot of healthy fats, they also contain a lot of calories, so it's important for parents to monitor their children when they're eating nuts. Dairy is another component needed on a healthy plate. Consuming dairy contributes to bone health. This is especially important for children because they are constantly growing. Children ages 4 to 13 should get 2.5 cups to 3 cups of dairy per day. 1 cup of dairy is equal to 1 cup of milk, 1 cup of regular yogurt, or 2 ounces of cheese. It's recommended that when looking for dairy, choose the fat-free or the low-fat option. Oil is the last component needed on a healthy plate. Normally, children consume oils through other food that they eat. Nuts, fish, and salad dressings all contain oils. If a child is not consuming these foods, it's recommended that they get about 4 to 5 teaspoons of oil per day. Canola oil, corn oil, and olive oil are all cooking oils that can be combined with food so that children get the requirements of oil that they need. Unlike the food pyramid, where oils, fats, and sweets were left to be consumed if all of the other food groups were satisfied, according to Healthy Plate, unhealthy fats and sweets should be consumed very minimally. An article in the New York Times goes over some of the controversies with this new plate. For instance, some say that the plate is too general. Labeling a big part of the plate as protein can be misleading because grains and dairy products also provide substantial amounts of protein. Some individuals also have issues with buying their children healthy food. They say that healthy food could be too expensive. In the long run, healthy food will actually end up being cheaper because it sustains hunger for a longer amount of time. Whereas chips and other processed foods are cheap, more of these products will have to be purchased because they do not sustain hunger like vegetables or fruits do, which contain more fiber. Also, eating healthy can help reduce the risk of medical bills later in the future. Unfortunately, the American diet for children today usually does not consist of these healthy food groups. Energy-dense foods such as French fries, chicken nuggets, and sugary drinks are more readily available and sometimes cheaper than healthier foods. The Center for Disease Control states that 80% of youth drink sugary drinks on a normal day. Sugary drinks are the #1 source of added sugar in America, which contributes to excess calories in the diet. Healthy People 2020 seeks to reduce consumption of calories from solid fats and added sugar in people ages 2 years and older. Currently, 34.6% of the total calories consumed in a day are from saturated fats and added sugars. Healthy People would like to reduce that number to 29.8%. There are two main reasons why children are not eating healthy. The first reason is what is being advertised on the media. A study was done by PLOS One Journal on all fast food televised advertisements from July 1st, 2009 to June 30th, 2010. 79% of all of the fast food restaurant advertisements for places such as McDonald's and Burger King were found on only 4 channels. These channels were Cartoon Network, Nickelodeon, Disney XD, and Nicktoons. Visual branding was more common in children's advertisements compared to adult advertisements, with emphasis on packaging, location of the restaurant, and giveaways or prizes that are included in the meals. These advertisements also focus on relating the restaurant and food to new popular movies that children might have recently seen. Children are influenced greatly by the media, and sometimes this is going to be in a negative way. Because children can be naive, they're not able to realize that they are under the effect of successful social marketing. The other reason why children are not eating healthy is because of their environment. Parents or caregivers are the most important influences on their children. It is not uncommon to blame obesity in children on their genes, especially when their parents are obese. While genes do play a factor in the health of a child, it is more common to find that parents' unhealthy eating habits affect the children. Schools also have an impact on the food choices of children. The Center for Disease Control found that among middle school and high school students in the United States, more than half of the schools offered sugary drinks and less healthy foods for the students to consume. Healthy People 2020 created an objective that wants to increase the proportion of school districts that require schools to make fruits or vegetables available whenever other food is offered. In 2006, only 6.6% of schools were required to make fruits and vegetables available. Healthy People 2020 would like to increase that number to 18.6%. Nutrition is very important for a child to maintain his or her weight. Healthy eating habits that are learned in child are carried on throughout adulthood. It is important that the parent or caregiver of a child instills healthy habits in their children so that they can have a healthy future. Now we will go to Erin Carney, who will discuss physical activity relating to obesity.
Thank you, Olivia. Healthy People 2020 has many objectives to aim to reduce the obesity epidemic in children. Healthy People 2020 wants to reduce the proportion of children aged 2 to 5 years old who are considered obese. In 2005 to 2008, 10.7% of children were considered obese. The target is to get that down to 9.6%, which would be a 10% decrease. In children aged 6 to 11 years old, 2005 through 2008, 17.4% were considered obese. The new aim is to get that at 15.7%, which is also a 10% decrease. They would also like to reduce the proportion of children and adolescents aged 2 to 19 years old who are considered obese, which is currently at 16.1% to down to 14.5%. They also have some developmental objectives which are not yet fully formed. The first two objectives listed on Healthy People 2020 are to increase the proportion of adults who are at a healthy weight and to reduce the proportion of adults who are obese. By reducing the rate of childhood obesity, it will in turn accomplish these objectives in the future because the children will grow up to be healthy adults. The Center for Disease Control says that children and adolescents should do 60 minutes or 1 hour of physical activity each day. If it is not possible to get that in all at one time, the activity can be broken down into 2 30-minute sessions, or 4 15-minute sessions. But the total should be 1 hour a day. These activities should include aerobic activity, which could be running and any activity that gets the heart rate up. Muscle strengthening activities are also necessary, such as gymnastics or playing on the jungle gym. Children also need bone strengthening activities. Running and jumping are examples of those. Each of these activities need to be incorporated 3 times per week. The American Heart Association says that one of the problems parents face is getting their children to be physically active. Physical activity should be increased by reducing sedentary time. This time includes time spent sitting in front of the television, in front of the computer, or talking on the phone. Physical activity should also be fun for children. This will help children become more active. The biggest influence that parents can have on their children's physical activity is to be an example for them and be active as well. Physical activity is necessary because it produces overall physical, psychological, and social benefits. Inactive children are likely to become inactive adults. Factors impacted by physical activity include weight management, reducing blood pressure, raising HDL, or the good cholesterol, and reducing the risk of diabetes and some kinds of cancer. Physical activity impacts psychological well-being by gaining more self-confidence and raising self-esteem. Nutrition and weight status is a very important topic that is discussed by Healthy People 2020. The focus of childhood obesity within the topic of nutrition and weight status was discussed today by speaking about risk factors and disease associated with childhood obesity, along with preventative measures such as nutrition and physical activity. Childhood obesity is in more need of urgent help than adult obesity because obese children will most likely become obese adults. We need to slow this growth down and take control of this problem. Obesity in children can cause risk factors for many diseases. This can easily be prevented through a nutritious diet and frequent physical activity. We as health professionals know what needs to be done. Children should be learning and having fun, not dealing with health issues. Thank you for attending our panel presentation brought to you by Recess.